7-year efficacy of RTS-S01 malaria vaccine among young African children. What is malaria? Malaria is a parasitic disease that involves flu symptoms. Plasmodium falciparum passes to human by the bite of infected Anopheles mosquitoes. After infection, the sporozoites travel through the bloodstream to the liver, where they mature and release another form called merozoites. The parasites enter bloodstream and infect red blood cells. Symptoms include anemia, bloody stools, chills, fever, sweating, coma, convulsions, headache, jaundice, muscle pain, and vomiting.
What do you think is the world's deadliest creature and endangers human life in just 1 year? Sharks kill 12 people. Grizzly bears kill 90 people. Crocodiles kill 800 people. Hippos kill 29,000 people. Snakes kill 90,000 people. But the tiny mosquitoes kill 2 million people. And over 600,000 of these deaths are caused by malaria alone. What is malaria? It's a life-threatening disease caused by parasites and transmitted through the bites of infected mosquitoes. 3.4 billion humans, that is, half the world's population, have a threat of malaria. Why do so many people die from malaria? Why can't they go to a doctor? Why don't they get rid of the mosquitoes? Poverty. People living in poor and unhygienic places are at risk, and children are the most vulnerable. Globally, a child dies of malaria every 30 seconds. Who is at high risk? Young children, pregnant women, people with HIV/AIDS, international travelers from non-endemic areas because they lack immunity. Symptoms of malaria: muscle aches, nausea, vomiting, or diarrhea, fevers, headaches, shaking chills, seizures and mental confusion, kidney failure. Malaria treatment: prevention, education, treatment. Prevention. Treated mosquito nets are the simplest and most effective way to prevent malaria. 23% reduction in malaria deaths are reported among those who use mosquito nets. Education. It is vital for any family which receives a net to also receive an education about how to use the net, how often to replace it, and how to get rid of mosquito breeding areas such as puddles, standing water, etc. Treatment. A child suffering from malaria will receive anti-malarial drugs, intravenous medication, transfusions, and breathing treatments. Let's take a look at the price of malaria. A malaria-stricken family spends 25% of its annual income on treatment. A high percentage of children's schooling impaired by absenteeism due to malaria in endemic areas. 1% malaria continues to slow economic growth by 1% every year. Did you know? Malaria is the Italian word for bad air. Malaria has been around as long as we have. Some Egyptian mummies show signs of malaria. Abraham Lincoln had it, so did John F. Kennedy. Malaria killed 1 million soldiers in the U.S. Civil War. It killed more people in World War II than combat.
Malaria vaccine pros. RTS-S acts against Plasmodium falciparum, the most deadly malaria parasite globally and the most prevalent in Africa. It is the most advanced malaria vaccine candidate the world has seen. The clinical testing of RTS-S is at least 5 to 10 years ahead of other candidates' vaccine. It is also the first malaria vaccine to obtain a positive scientific opinion by the European Medicine Agency, a stringent medicine regulatory authority. Malaria vaccine cons. It offers no protection against Plasmodium vivax, which predominates in many countries outside of Africa. The vaccine is being considered as a complementary malaria control tool in Africa that could potentially be added to and not replace the core package of proven malaria preventive diagnosis and treatment interventions.
evidence is emerging that the efficacy of malaria vaccination can wane over time. The potential for an increase in malaria cases as immunity wanes may lessen the utility of malaria vaccines. This phenomenon, known as age shift, may be particularly important in communities with high malaria transmission. The authors of this study sought to determine whether there was age shift with the RTS-AS01 malaria vaccine. They vaccinated children between the ages of 5 and 17 months, and then followed them for 7 years. In this extended follow-up of a Phase 2 trial that randomized 223 children to receive this malaria vaccine and 224 children to receive a control vaccine, the authors followed children for 7 years for evidence of clinical malaria episodes, which were defined by a temperature of 37.5 degrees Celsius or higher, and infection with more than 2,500 Plasmodium falciparum parasites per microliter. The 223 children given the malaria vaccine had 1,002 malaria episodes. The 224 children given the control vaccine had 992 episodes. Children given the malaria vaccine had fewer malaria episodes in the first 48 months, but more episodes over the longer observation period. Vaccine efficacy thus waned over time, and there was negative efficacy during the 5th year after vaccination for children in high malaria exposure areas. The authors conclude that this malaria vaccine is initially protective against clinical malaria, but that benefit is offset by rebound in later years in areas with high malaria exposure. Full trial results are available at nejm.org.
Conclusion. The malaria vaccine is the best method to prevent the spread of this disease caused by Plasmodium. Above all, vaccination is important in countries like Africa that have a high rate of children infected and because of their economic situation cannot carry a correct treatment, so many times patients end up dying of malaria.